Hi, Lisa Workman here, clinical exercise physiologist with another installment of Real Moves for Real Life. And we're laser focused towards the hip again today, simply because this joint is just so amazing. It can do so many different movements. And if you're like me, you kind of take for granted all of the things that the beautiful hip joint does for us. So quickly, orientation again back into that hip joint. We're looking at the two bones, the leg bone and the pelvis. And so that leg bone goes into this nice hip socket as a fossa where that head of the femur sits inside. And so when you want to think about that head of the femur, it's kind of like a little ball. And to show you here, I've got another bone here. Here's the leg bone. And we're going to let that come a little bit more forward. And you'll see this wonderful rounded tip. Now, of course, in you and I, likely, we don't have this screw sticking out, but just forget that that's there. And you can see that it's really this rounded, beautiful sculpted bone. Now, of course, this is just a model, and you and I, our hip might look slightly different. It's not perfectly like this, but you can imagine that ball that fits inside of that socket or that sort of envelope, you could call it. And so with that setup, it allows our hip actually to move in 360 degrees. Unbelievable, isn't it? It rotates all the way around. And so that movement we call in anatomy is circumduction. Now, you don't have to remember circumduction. You could just remember circle. So that hip joint goes around in a circle within that socket. And so today I'm going to show you some specific exercises that allow that leg bone to move in that 360 degrees. Now, of course, we are going to run into some of those other hip movements that I've talked about on this channel before. We've got hip flexion and extension. We've got hip abduction and adduction. And we also have hip internal and external rotation. So there's a lot of things going on when we are doing circumduction with our hip. So come along with me and I'll show you some new exercises to move that hip in the circle sort of way. All right, let's get into the exercises for hip circumduction, or essentially drawing circles with our leg bones. So I'm down on the floor on a mat, but if that is not good for you, you're welcome to go up onto a couch or go up onto your bed. You do not have to be down on the floor, but you do want somewhat of a firm surface so that we can get some really good support for the rest of our body. So we'll come onto our backs, knees bent, feet flat on the floor, and just sort of take a moment to settle into this lying position. There's really no rush. And what we want to think about is that pelvis. So if I grab my model here, we'll put it right beside me so that we can get an image of what it looks like to sort of lie on your pelvis. So you'd have the bottom of the pelvis, sort of where our coccyx bone is, or very tip of our tailbone. You should feel a little bit of that part of the bone on the ground. And then you'll feel more of this triangle part of the pelvis here, also on the ground. So feel for that in your body for a moment. Again, no need to rush. Adjust those ponytails as I am, trying to find the right position for that as well. And then take a quick glance at your legs and just make sure that the legs are an extension of that hip joint. So in line with the hips as best we can, feet parallel to one another. And just see if you can allow the heaviness of the pelvis to sort of anchor you to this lying position. At any time point, if your neck isn't loving this position, you're welcome to put something underneath your head. A little blanket or a pillow is fine. My little ponytail here is holding my head up. And then what we'll do is we will bend at the hip here. We'll flex that hip and bring it slightly up so that now the thigh, that leg bone, is perpendicular to the floor. So taking that action, a little bit of a contraction here through that hip, and you may have seen this before. But this time, what we're going to do is imagine that on the top of your kneecap, you have a big Sharpie, one of those big fat felt pens. And you're going to take that pen and start drawing a circle as best you can on your ceiling. So imagine that drawing happening. So you're taking that leg bone and circling it around, focusing on the movement coming from that hip joint, and imagining that ball in that socket is rolling around. And as I alluded to earlier, is the fact that we're going into a little abduction, flexion, adduction, and extension of the hip. So there's a lot going on to make the circular motion. Now, of course, go a couple times one way, come to a little bit of stillness, take a moment. You may even want to lower the foot just to make sure that you've got that stability and strength through the floor and through your pelvis. And then you'll come and go the opposite way. So just be kind of curious and see, does one way feel a little different than the other? And I'll be honest with you, for me, I just was like this, I did the easy one first. So this one is clearly not drawing circles. It's drawing I don't even know what it's drawing. It's probably drawing like a hexagon here with my knee. So just be curious. Which did you pick? Which direction did you pick first? And then how does that feel? Is there a little bit more catching? Is there a little bit more stickiness? I can definitely feel that different the other direction. Good. And then just come to some stillness. Relax for a moment. If you've been holding your breath, please start breathing. And we're going to move to the other hip. So the leg's going to come up, a little flexion of the hip. Thigh is now perpendicular to the floor. We're now working on the other side. Now this time you can imagine that you have some of those thick markers, but they're the smelly ones. Get a smelly marker, maybe a grape or a raspberry. I think I'm going to pick the grape one, the purple one. And I'm going to take that marker and draw a circle again, moving from that hip socket. The movement is not very large. And if we really think about it, we want to keep that pelvis as quiet as possible. So it's not huge leg movements, but are very, very strong movements in some aspects. You might be feeling this action a little bit more. And again, depending on your mobility in your hips, you might feel one side is a little bit more jerky or choppy. That's kind of what I'm feeling for myself. And you know what? That's okay. Just some information. No judgment. Good. Come to some stillness. Drop that foot down for a moment. Just kind of feel it out. Just seeing, is there anything more that you could do to soften this movement, to find a little bit more ease in that movement? And maybe that little circle with the smelly marker becomes even a tinier circle. So lifting that foot back off the floor, we'll go the opposite direction. So coming around through that circle, and you might start to feel like a bit of shifting happening. Potentially, you might feel a bit more smoothness going this way, or even a little bit more stickiness. Again, it's all about that leg bone in that hip socket. Even imagine that your leg bone is a stir stick in a cup of coffee, right? You're stirring it around, making those nice circles. That big long leg bone is acting like that stir stick. All right, I've had enough. I can feel it already. I'm starting to compensate. So I need to stop and just take a moment. So you go ahead and feel free to keep going with those circular motions at that hip joint. Remember, we've got circumduction or circles that can occur just because of that structure and that ball and socket joint. And just take a breath or two here and just let the body relax, because we're going to progress this. And how we're going to do that is by extending the leg out straight. So once we lengthen our bodies, that is when we add more challenge, because we have a limb that becomes longer and a lot more hard to move. So this time, that big fat sharpie is on the bottom of your heel. We're going to slightly elevate the leg if you can, and we're going to try to draw some circles with the bottom of the heel of your foot. So changing the orientation of where the leg bone is in space is going to also add sort of a bit of a challenge. You might feel a little warmth, a little tightness through the front of the thigh. That muscle has to engage to keep that leg elevated. And as soon as you start to feel like those circles turn into ovals, go ahead and come to stillness, take a little break. And if you're feeling this in your low back at all, that is a sign that simply this is maybe too much for your body. So always go back to that first one where our thigh was perpendicular to the floor, because the back loves to take over. And so just be watchful of any sensations. And then we can go ahead and do the opposite direction and feel how this movement is maybe slightly different than when that knee was bent. Not only from an intensity perspective, but also from a movement perspective. Is it also choppy this side with the same direction, or has it smoothed out a little bit? Beautiful. Okay, let that leg relax for a moment. Take a little break. Who knew such small movements would be so intense? Go ahead and bend that leg and we'll come to the other leg. So this time we've got that smelly marker on the bottom of that heel. Elevate that leg ever so slightly, and then we'll add that sort of rotation. So just these little tiny rotations. We don't have to go big. Maybe just starting to notice if the other leg is starting to lean and what's happening with that leg. Good. Take a little moment, a little rest. And then we'll go the opposite direction. So lifting that leg up, allowing that leg to go around and around, allowing that smelly marker to, of course, draw a circle with your heel. Go ahead and come to a relaxed position. If it feels good in your body, you might want to extend your legs both out and just place your hands on top of those hip bones, saying thank you for doing all that hard work. Again, any tightness, any clenching, anything else happening in the rest of your body is just an indicator that you're compensating, or you're doing a movement to help that hip move, when in fact, potentially that hip doesn't need that help from that area. So that low back is probably the most common spot where we'd feel that. So you can place those feet flat on the floor. Just adjust that pelvis a bit. And once you're ready, you can roll over to the side, and we're going to come into one last position to try. So this is going to be, again, a different orientation. This could be a little bit more challenging. We are actually now switching from working against gravity to let gravity help us. So let's see how that feels. So we'll come to hands and knees position. If that doesn't feel good for your knees, you're welcome to put a towel under your knees or fold up a mat a bit more. If hands and knees just feels a little bit much on those knees, we won't be here for very long. So just from a demonstration perspective, we want to make sure that the hands are underneath the elbows and elbows underneath the shoulders. Our leg bones are perpendicular to the floor. Now, we're going to lift that one leg up off the ground slightly, trying to keep your pelvis as level as you can. And guess what? Where we're going. We're drawing circles now with those kneecaps again. That one way and then the other. So now the body is no longer being supported by the floor, so it becomes a little bit more intense from that perspective. However, when you're in this position, that leg bone is now being sort of pulled down by gravity. It's no longer that coffee stir stick. So you might feel like you get a little bit more opening through that hip simply because of the way your body's positioned in space. So once you're ready, if you haven't done the other side, you can do the other side. And of course, we would switch and do the other leg with our smelly marker on our kneecap. Just noticing sort of what is going on. Do we feel a little bit more slide and glide now because we've been doing some of this work? Or are you finding this hands and knees position might be a little too much for you? So essentially what we have done we have taken that leg bone and rotated it around and around and around in that hip socket, both one way and then the other. I encourage you just to simply feel what's going on in that hip socket. One way versus the other, left versus right. There's so much information that our body can give us in such small and compact and quite frankly, simple exercises that we can do at home. Simple, but not necessarily easy. So hopefully these exercises have been helpful, all about that hip joint and drawing some circles, or we could call it circumduction.